So I've just entered my patient's room. I've let them know who I am, and I'm verifying with them their name and date of birth, and maybe match it up with their wristband just to be sure. I am going to explain to them what we're doing today, see if they have any questions. I'm going to make sure the bed is raised to the adequate height for me to work at, and raise the head of the bed to the full Fowler's position to have them upright and erect. And I am going to place a Chuck's pad over the chest just to catch any residual while we do our procedure. And while I do that, I'm going to put my gloves on. And the next step is I'm going to measure the NG tube from the nose to the ear down to the xiphoid process. So I have my tube here. I'm going to bring it over. Start from the nose to the ear, down to the xiphoid process. And I'm going to bring this back over, and now that I have the level that it should be at, I'm going to mark with a Sharpie or use a piece of tape just so I know how far the NG tube should go. Once I've done that, I've also, before I started any of this process, I also washed my hands. And I've come over here and I've gathered all my supplies, made sure everything is adequate and ready to use. I have a cup of water, an emesis basin, tissues for the patient, and I have prepared my tape to use that to secure the tubing. So once I have marked on my NG tube, I'm going to make sure the tube is lubricated up to 4 inches or 10 centimeters. And after I've done that, I'm going to take the NG tube and bring it over to my patient. And also, while I'm doing this, I would make sure she had her emesis basin and her any tissues, just in case her eyes started watering, and I'd have the cup of water prepared. I would grab below where the tube is lubricated, or above, and make sure that the angle of the tubing I'm going to be putting into her nose is facing down. And then, so I'm just going to take this, and I'm also going to have her head, have her hyperextend for me, and also let me know if at any time she has to stop and give me some kind of indicator, maybe tap my arm, something that lets me know if she's uncomfortable and needs to take a break. So I'm going to take the NG tube and I'm going to insert it into her nasal passage, on the floor of her nasal passage, towards her near ear. And I'm going to just start slowly, and as she has her head hyperextended, I'm going to slowly insert it up until just a little ways up until the back of her nasopharynx, and then we're going to give her a break. I'm going to give her a cup of water, and I'm going to instruct her that I'll need her now to bring her chin to her chest, and she's going to continuously drink her water through a straw as I finish inserting the tube the further down into her gastric area. So I'd give her the cup of water, instruct her, I'd say, okay, keep drinking, and then I would advance the nasal tube 2 to 4 inches with each swallow. So we're gonna just continue to insert that, rotate it a little bit, but not, we're not gonna force anything. We're just gonna gently advance the tubing as she's drinking it. And once we've reached the area at where the tubing stops, we're going to take a piece of tape and just hold it into place while we can check to make sure the tube is in the correct placement. So then how we would do that is I'm going to take a look in the back of her throat, make sure that I can see the tubing. Then I'm going to aspirate some of the stomach contents, check the pH, check the appearance, the color, texture, and then we would go for a chest x-ray and make sure that everything is in an adequate place. After we've made sure that it's where everything needs to be, we would take this piece of tape off. And I have a piece of tape that is stripped down the middle so we could place it on the bridge of her nose. And then wrap one piece around so it'll secure the area. I will also mark at this point where it is in below her nose. So if it comes out a little too much, or if it moves at all, we'll be able to know. Once we have that secured, I'm then going to make sure that the tubing is secured to her Johnny. I'll use a piece of tape, wrap it around the tubing, and put a safety pin through it, and then just kind of connect it to her Johnny. That way it can't pull or anything like that. Once I've done that, I'm going to remove the Chuck's pad and make sure that the patient feels okay, that she's not having any pain, discomfort, and if there's any questions she might have. I'm going to clean up my area, wash my hands, take off my dirty gloves, and I will lower the bed to its original position, give her the call bell, see if she has any questions. I'll bring up the side rails, and then I will go and document my findings.